Could you share with us, if you have some examples of stories of Canadians who died in entirely preventable ways if they just simply had access to that medical procedure?
Oh, for sure. And there was a patient in Alberta, his name is Jerry Dunham, and he passed away leaving behind 2 young children. And in Jerry's case, he was waiting for a pacemaker. And the system told him, no, we're too busy. We're focused on COVID. That's essentially what happened.
On a pacemaker?
A pacemaker.
To me, that sounds so routine.
It's routine. It's very important for your heart,
right. Obviously.
And so he waited. His condition worsened, and sadly, he passed away. And now those 2 kids, they don't have a father. In Ontario, we spoke with a retired nurse, Judy Anderson, who told us about what happened with her daughter, Shannon. She was 44. She had heart problems, went to her doctor. They said, you've got a condition that's treatable, but the problem is it's going to be a 1-month wait. And she was very concerned about this. She went to a second doctor and was told that it would take a year for an alternative procedure. And what ended up happening was that she waited as long as she could. And sadly, her condition deteriorated. And she passed away, leaving behind 4 children. So these are the very real cases that are behind these numbers. And, as I mentioned at the beginning, it's not just patients dying, it's losing that quality of life in their final years. So you can imagine if a patient was maybe waiting for a hip operation for the final 2 years of their life. And in the meantime, they're living with chronic pain. They're being told to pop painkillers constantly. When people are in those conditions so often, they get stuck in their homes because they can't go out. It's too painful. Having their grandkids come over is too hard for them because they can't run around after them or pick them up, cuddle with them and that. So there's a lot of patient suffering that's been happening. And, as I mentioned previously, governments often don't do a very good job of tracking this data, and they certainly don't do a very good job of releasing it. And I think that's one of the problems, is that the system is failing and no one wants to talk about it from the inside. But they will quite happily talk about when private businesses fail. Governments will talk about a business, a restaurant where maybe it didn't pass a food safety test or whatever. And I'm not saying you don't do that, but governments love to shine a light on those cases. They don't like to talk about it when they let down patients in the public healthcare system.
Yeah, that's a very interesting point you bring up. And in my opener, I hate to use the word compare, but I contrasted the amount of deaths, again, 11,500 and change, to the amount of deaths with COVID so far to date, and it's about the 30,000 mark. You look at those figures and you see the very dramatic, very severe response when we're dealing with COVID deaths. But when it comes to, as you said, something that the government itself could manage through wait lists and medical procedures and medical treatments, which the government funds and manages, I feel like there's less attention here. And you're right, there isn't as much of a light shone. People, I think, are experiencing it more now through COVID because many people are suffering longer waits, and they're wondering, why am I waiting at all? And I think, there will be a lot of more of these cases of the nurse in Ontario or that father of 2 who died waiting for a pacemaker. And it's sad, and it's really shocking and disturbing to me. So, we only have about 30 seconds left. What would you like to see governments do to make this better?
Well, they've got to track the data better. They've got to disclose it better. And I think if your viewers are wondering what they can do, they can ask their local elected officials how many patients died over the previous year because they didn't receive the care they required in time. And if that elected official can't provide an answer, then I think the follow-up question is, well, aren't you concerned about this, that you don't know the number? Isn't it a problem if patients are dying because they're not receiving the care they need? And ask lots of simple questions, because I think we're going to find a lot of bad answers when it comes to it. And that's a problem. We need to understand better and track better how much patient suffering is happening in the system.